Hey everybody, it's Chris, and today I'm interviewing the legendary Dr. Alan Goldhamer. Dr. Goldhamer founded True North Health Center back in 1984, and he is one of the world's foremost experts on water fasting. For those of you who have followed me for a while, I've done several interviews with other water fasting experts and doctors, and Dr. Goldhamer is such a brilliant man, and he's been doing this a long time. I think he's overseen about 20,000
Yeah.
individual patients through a water fast, through a medically supervised water fast at his clinic. And so this is going to be fun. You're going to learn a lot, and I can't wait. So, Dr. Goldhamer, thank you for taking the time to talk.
It's my pleasure. I'm happy to be here.
So, I would love to know right off the bat, how did you discover water fasting, and what convinced you that it was something that would produce remarkable results in a person's health?
Yeah, I wasn't looking for information on water fasting originally. I was just interested in figuring out how health worked. I was actually motivated to become a better basketball player when I was a kid. I wanted to beat Dr. Lyle in basketball. He's our clinical psychologist now, and I grew up with him, and he just beat me mercilessly. And so I started reading, and I read a book by Herbert Shelton. And he said something that I thought was very interesting. He said that health was the result of healthful living, and that healthful living involved diet, sleep, and exercise. And he talked about this use of fasting to undo the consequences of dietary excess, when things hadn't been followed properly. And it made a lot of sense, since most of the people that were sick from conditions of dietary excess. So obesity, diabetes, autoimmune diseases, many forms of cancer are intimately associated with dietary excess. It made sense that fasting might be useful at undoing whatever it was the dietary excess was causing. And so, as I read more about it, it made much more sense. Unfortunately, it didn't help me beat Dr. Lyle. I'm 63 years old. So is he. He still beats me mercilessly whenever we play basketball. So I'm hoping that maybe as we age out, we get into our 80s or something, maybe he'll age out a little quicker, and eventually I'll be able to beat him. So even though it completely failed at helping me meet my goal, it got me very, very interested in this idea of how could you help people that were sick get well, and more importantly, perhaps, how can you help people that are healthy stay that way?
Can I show you something?
Herbert Shelton, Fasting Can Save Your Life. That's a classic book there.
This is from 1975.
Yeah.
This is in my mom's library.
Yeah.
Yeah.
And so for the last 39 years, we've been operating True North Health Center. As you mentioned, we've had 21,000 people undergo fasting. And more recently, in the past 6 years, with the formation of the True North Health Foundation, we've been able to do some original research and are publishing increasing numbers of papers in the scientific literature about what actually happens to the body when it fasts, and what happens to individuals with health conditions when they fast, and follow it with a whole plant food SOS-free diet.
So you got interested in fasting. You did some fasting as a young person, and which is fine, but you didn't have any real health problems, right?
No, I was very fortunate. I got started so early, and I decided to do an experiment when I was a teenager, and that was to see, what would happen if I applied these diet and lifestyle principles in the use of fasting. And I decided to try it for 50 years. And I thought that after 50 years, I'd have a pretty good idea of whether it was working or not. So that was 46 years ago. So I still have a few more years before I determine whether it's effective. But so far, it seems like it's working pretty well.
All signs point to yes.
Yeah, I would say right now that we'd be inclined to be positive about the outcome.
So yeah, that is pretty amazing that you got such an early start. And so I'd love for you to talk about what happens when you fast. What's happening in the body? Why is fasting more than just a spiritual practice? Why is it always also a physically beneficial practice?
It is interesting that virtually every religion, from the Jews to the Jains, the Hindus, the Muslims, the Christians, all have a tradition of fasting in their teachings. They may disagree on a lot of other things and sometimes kill each other in the street over their disagreements, but there's a uniformity of agreement that fasting has an important role, both for spiritual as well as physical means. Fasting changes how you feel about yourself and the world around you. You can't help it. Whatever your religious beliefs are, it seems to have enhancing impact. And fasting itself is a biological adaptation. In other words, human beings had to be able to fast. Every human that didn't have the ability to fast died. It was a death sentence, because we have this huge brain. Modern humans have a huge brain, and it's our biggest burner of glucose. So we burn 2.5 times as much glucose, say, for example, as chimpanzees or some other. And chimps, interestingly, don't fast. They don't have the ability to change their brain from burning their normal fuel, which is glucose, to burning an alternative fuel, which is fat, and in particularly beta-hydroxybutyric acid.
Really?
So that's why a chimp will never wander away from the tropics, because if they did, the first time spring comes late, they'd all die, because they can only go about a week or so without eating, because they're going to gluconeogenesis, burn up their protein, and eventually succumb. Humans change our fuel from burning glucose to burning fat. And so a 155-pound male, a skinny male, could go as much as 70 days without eating. Now, if our brain didn't do that, if we couldn't fast, if we couldn't change from burning glucose to burning fat, we would only be able to go about a week. It's because of the ability to fast that we can go so long. And it was so critical for humans, because our brain is so ridiculously large and it burns so much glucose, that we had to have this ability. So the people that had that ability survived, the ones that didn't died. And now everybody, with a very rare exception, people, for example, with MCAD, medium chain acetylcoenzyme A dehydrogenase deficiency, that's a genetic defect where they can't break down fatty acids, they would not be able to fast. That's 1 in 10,000 people. So we test everybody, and so we make sure we don't fast the wrong people. And that's an important thing to remember, is that not everybody at any given time is a good candidate for fasting. There are many people where fasting would actually be contraindicated, where it would do more harm than good. For example, if you're pregnant or lactating. If you're lactating and you try to do a prolonged water fast, you're going to lose your milk production, not a good thing. If you have anorexia nervosa, which is actually a neurological condition that where people want to fast, they perceive themselves as being very large, even though they might be emaciated. Fasting is not for the treatment of anorexia nervosa. If you're a type 1 diabetic, not a type 2 diabetic, which is 95% of diabetics, where they have insulin resistance and responds great to fasting. It reduces insulin resistance and normalizes blood sugar levels. But type 1 diabetics don't produce insulin because their islets of Langerhans and their pancreas have been destroyed by their body's immune system. And one of the triggers for that is, interestingly enough, drinking cow milk. If you feed genetically vulnerable kids cow milk, the body's immune system will destroy their islets of Langerhans. That's a large part of what type 1 diabetes is thought to be from. So they wouldn't be able to fast, because you need a certain amount of insulin in order to adapt to the fasting process. So without insulin production, it would be very difficult to fast. You'd be very vulnerable to ketoacidosis, and you'd get into respiratory problems, and it's not a pretty picture. If you've had a condition where they've had to use anticoagulant therapies, the Coumadin or the other medications that are used commonly for these problems, you would have to be very careful about fasting, because you can't just arbitrarily discontinue those medications without increasing risk of stroke. And you don't want to fast on those medications, because many of these medications in general can be potentiated during fasting and create a lot of problems that they wouldn't create in the fed state. So that's people that have had like stroke, myocardial infarction, pulmonary embolism, DVT, something where you've had to be on anticoagulant therapy, the Eliquis, the Coumadin, et cetera. Now, those people can sometimes do modified versions of fasting that would allow them to safely continue, but it wouldn't be water-only fasting. If you've had a recent heart attack or stroke, again, oftentimes that would indicate a use of anticoagulant therapy. If you have severe kidney disease, where your creatinine levels are over, for example, 2.0, you wouldn't want to do a water-only fast, because the detoxification that happens in fasting is largely done by the kidneys. People think about the bowels, but the bowels really are a secondary source of detoxification. Think about when you put something in your mouth and it goes through the digestive system and eventually gets to the rectum and you push it out the other end. That's never been in the body. It only gets in the body if it gets absorbed through the intestinal mucosa. And so the bowels are not the main source of the toxins in your body getting out of your body. The way that happens is the stuff that's in the blood is processed by the kidneys. It's eliminated in the urine. So it's important to realize you have to have a certain level of kidney function in order to safely be able to adapt to fasting. It's also why we wouldn't recommend, for example, dry fasting, where you're not consuming any water, because then you don't have a solute to put the toxins into and get it rid of. And that will build up and eventually shut down your kidneys. In fact, recently there was a famous internet advocate of dry fasting that passed away, secondary to kidney failure. You know, kind of what happens if you overload the system. So we wouldn't recommend not getting adequate water intake, and you wouldn't recommend fasting in people that don't have adequate kidney function. So we measure everybody's function before we start fasting and monitor it during fasting to make sure that it's working properly and we don't end up with failure. There are genetic defects in rare people. We mentioned MCAD, medium chain acetylcoenzyme dehydrogenase deficiency. That's 1 in 10,000 people, but those genetic defects, other things like porphyria or other things, would be relative contraindications to fasting. If you have deficiency, depletion, or cachexia, fasting may not be for you because you have to have adequate nutrient reserves. Now, it's true the body recycles those during fasting, which is why you can go 40 days or longer without supplementation. You think, well, why wouldn't you develop deficiencies? It's because of the recycling efficiency in water-only fasting. If you're on medications, with rare exception, you have to be able to safely withdraw those medications before you would implement water-only fasting. And if you cannot rest, you should not fast. And people say, well, why? If you exercise, you'd lose more weight, wouldn't you? Yeah, you'd lose more weight, but it wouldn't be fat. It would be actual muscle and lean protein. What happens in fasting is the body goes into a conservation mechanism, but you still need a minimal amount of glucose. So if you increase your glucose needs by too much brain activity, too much muscle activity, the only place the body can get that extra glucose efficiently is through breakdown of protein.
Even if you're overweight, exercise during a fast is going to result in muscle loss?
Contraindicated. It will. And in fact, we've done a study to prove that. We actually took a DEXA scanner that allows you to do detailed whole body composition. So not just how much fat there is, but how much visceral fat there is, et cetera. And in this study, what we did is we monitored patients before, during, after fasting, actually at 6-week follow-up, and now we're getting 1-year follow-ups too, interestingly enough, in papers that'll be coming out this year. And what we discovered was that the body loses weight during fasting, about 1 pound a day. And it's composed of fat, including visceral fat, protein, fiber, glycogen, and water. And then when you come off the fast, you regain weight. And what you regain is water, glycogen, fiber, and protein, but not fat. When applying a whole plant food SOS-free diet, the fat loss continues. The lean tissue recovers. And in this study that we'll be publishing this year, it actually shows that the lean tissue mass of the individual on recovery is actually higher than it was when they started fasting. And that the fat not only went down during fasting, but it continued to go down all the way through recovery. And that visceral fat was preferentially mobilized during fasting at a higher ratio than anything else that's been shown, including keto diets and all the other kinds of stuff that's going on out there. That the ratio of visceral fat to adipose tissue is up close to 3.0. So what that means is that a person that might lose, say, for example, 20% of their adipose tissue during a 2-week fast may lose as much as 50% of their visceral fat. And the 4% of lean tissue is recovered during refeeding. And so the overall composition of the body changes when fasting is done properly. Now, you still have to eat well in order for that to happen. You can't go back to greasy, fatty, slimy, dead, decaying flesh processed foods and expect that that's going to happen. But on a whole plant food diet, lean tissue recovers, hydration recovers, fat continues to lose down to optimum weight. So it's very exciting. And again, for people that are interested, they can go to our website. Fasting.org is the foundation's website, and all of the studies that are coming out or will be coming out are listed there, and they can read for themselves the outcome data.
Now, I understand it's not good to fast if you're on prescription medication of any kind. That makes it pretty risky, but you actually work with patients when they come to you and help wean them off medications, yes. Correct? Yes. Before they undergo a fast. What does that process look like?
So it turns out that most people are medicated not for their condition, but for their diet that causes their condition. And so when you change their diet to a whole plant food SOS-free diet, SOS is the international symbol of danger. It also stands for the chemicals added to food that make people fat, sick, and miserable, and those are salt, oil, and sugar. When you take the salt, oil, and sugar out of the diet and feed people whole plant foods, the need for medications begins to drop dramatically. Blood pressure drugs, diabetes drugs. In fact, you have to withdraw those drugs. Otherwise, you end up with problems from excess medication and too low of pressure or too low of blood sugar, et cetera. So we carefully feed and wean those medications. We're fortunate to have medical doctors at the True North Health Center that are not complete idiots, unlike many in our society. And as a consequence, they are used to people actually getting well. And so they understand that just like you have to carefully put people on medications, you have to carefully take people off medications when they're no longer needed. So with the dietary regime, we're able to eliminate the need for medication safely and then begin the fasting process, which even further enhances the benefit of the diet in terms of normalizing the blood values and blood pressure, et cetera.
I know it's kind of hard to answer this question, but on average, how long is a person following the SOS-free plant-based diet at your center before they're ready to start a water fast, assuming they're on some medications? Like how much time are we talking about?
Well, it turns out that now the way it works most routinely is because there's a lag in getting into the center because we have a bit of a wait list, we have a telemedicine practice where our doctors are available remotely through Zoom. So the patients can work with these doctors remotely. By the time most people come in, they've already made enough improvements with their diet that the need for medications is already either reducing or gotten to the point where it just takes a few days to get them off the drugs. And so annoyingly enough, many of these people are getting well completely before they even come in. They work with I had people that were supposed to come into one of our hypertension studies, and they're working with our doctors. By the time they come in, their blood pressure is entirely normal. So, the doctors can't help it. That's how they are. But the bottom line is it's diet, sleep, and exercise are the most important interventions. Fasting is just a facilitator. If you really do the diet, sleep, and exercise, many of these problems resolve without the need to even do the fasting.
Well, you're working against your own best interest because a patient cured is a customer lost.
It turns out, though, there's a lot more people that need our care than we can provide the services to. So, recently we've been seeing a lot of patients with long COVID. They had COVID, they recovered, but now they have brain fog, fatigue, irritability, loss of taste, loss of smell. And interestingly enough, those patients we're finding when you fast them, it resolves the symptoms. And so there's like a whole new population of patients that we're going to have to start dealing with as we're beginning publishing some of these outcome studies this year with long COVID. We've also been seeing people that have had unfortunate reactions to the vaccination process itself. Not so much necessarily the first or even the second vaccination, but this booster process that people are going on that have autoimmune diseases predisposing. Some of them don't do well. And now we're beginning to use fasting with those patients to see if reducing the inflammation from those injuries is resolving. And so far, we haven't published anything yet, but so far it looks like there's some reason for optimism there.
Well, I think frontline feedback is really important, and we've seen in the last 2 years how many frontline doctors have been censored and criticized and just viciously attacked for just giving feedback on what they're doing that's helping patients. And
try talking about fasting and see what happens.
Yeah, exactly.
Water only fasting.
Watch your back.
Well, it's starting to change recently, but when I went into practice, well, first of all, when I went into practice a long time ago, 1984, at that time, a medical doctor, for example, couldn't refer somebody to somebody like me or accept a referral without it be considered a violation of ethical standards. Then the Wilk decision came around in 1986, and that started to shift a little bit. It's not uncommon for patients to be told by their physicians that fasting is criminal quackery. I mean, they're violently opposed. And then when the patient gets better, it's all either, well, you got lucky or, whatever it is. Now, as we're beginning to publish more information, and people like Walter Longo and others have been publishing so much interesting stuff in mainstream journals, it's starting to shift. And now this idea that fasting might actually be a helpful tool has become more accepted. And so now we're getting active referral rather than having the police come to investigate whether or not people are being held against their will by religious cultists and being starved to death so they can go to be with Jesus. That was one of the accusations. But So, it's a lot easier now because fasting has gained a little bit different view, particularly intermittent fasting, which Walter Longo and his group have promoted, and now slowly long-term water-only fasting. I think in part because we have managed to publish fasting safety studies, outcome data, and if you look at the research just from the True North Health Center, it's really quite compelling in terms of how effective fasting can be in treating conditions like high blood pressure, like diabetes, and also more recently lymphoma.
Well, yeah, the last decade, it seems like we've made leaps and bounds in terms of fasting studies. I've interviewed Walter, and his research is just absolutely fascinating, especially with regard to autophagy and stem cell activation, and how old and damaged immune cells die off during a fast, and then your body ramps up production of new healthy immune cells when you start refeeding. Like, that stuff is really incredible. And but I'd like to go back, because I know there's a lot more to say on this topic. But can you talk about when a person is water fasting, what's happening with the loss of sodium and the flushing out of water and that kind of stuff that's happening in their body, and then also the other good things that are happening at the same time?
Well, there's a lot of biological changes that happen
And
in
the
fasting.
detoxification too, like that
Yeah,
whole.
it's a pretty big topic, and it would be difficult to get into all the detailed physiology. What I can talk in general terms, though, is the body shifts, as I mentioned, from burning glucose to burning essentially fat. That, it turns out, it has some advantages, and a lot of people are trying to do fasting mimicking type effects. In other words, do what fasting does, but without actually having to fast. And I don't know how well that's going to turn out to work, but we do know in fasting, when the body's in a ketotic state and the brain is burning primarily beta-hydroxybutyric acid, lots of things change. Some things go down and some things go up. And for example, glucose and insulin go down during fasting as the ketones go up, and that creates an environment that's very favorable to healthy cells, but not favorable to cancer cells. Cancer have higher metabolic rates than regular cells, and when you lower the glucose environment, they are selectively disadvantaged, and that's where Walter Longo has been able to show that in cancer, cancer cells are more vulnerable to chemotherapy, for example, in the fasting state than in the fed state, and that healthy cells are protected from some of the damaging effects of conventional therapy. Once that was published, then the pharmaceutical people said, oh, great, well, fasting went from criminal quackery to cutting-edge research because you can do more conventional therapy with less side effects. So there became a big interest there. And now they want to come up with what are called fasting-mimicking drugs. So things you take that would get your body to do what fasting does, but without having to actually give up anything, and something you can put in a capsule and sell. Fasting reduces IGF-1, which is insulin growth factor 1. The lower your IGF-1 in general, the better off you are in terms of surviving. And there's two things we know that lower IGF-1 consistently. One is fasting, and the other is exercise. And you're going to hear this over and over again. The same biomarkers that change with exercise often change with fasting. And you might think, well, wait a second, that doesn't make sense. In fasting, you're saying you're resting. Exercise, you're vigorously active. Why would they both work on the same biomarkers? And it's going to turn out that fasting and exercise have one very important thing in common, is they both undo the consequences of dietary excess. And so it's not surprising to find out that the biomarker changes that are benefited by exercise are also benefited by fasting. For example, leptin. Leptin goes down in fasting, and the lower your leptin level, the lower the inflammation in general. Blood pressure and heart rate levels go down with fasting. And ultimately, as a consequence of exercise, although during exercise, obviously, they go up. mTOR is a mammalian target of rapamycin, and that increases, the lower your mTOR, the higher autophagy. And autophagy or autophagy is the self-eating, that where your body's immune system goes in there and gets rid of cancer cells, gets rid of the cellular debris that's associated with the breakdown of cells. And in fact, Yoshinori Ishimi won the Nobel Prize in Medicine for his work on autophagy. And one of the things that apparently dramatically enhances autophagy is fasting. Fasting also reduces the microbial load in the intestinal tract. In fact, you have about 5 pounds of bacteria living in your intestinal tract. Think about that, 1 trillion creatures, living creatures, swimming around inside your digestive system, eating, drinking, and defecating inside you right now. You've got 5 pounds of creatures pooing inside your digestive system. And they might be pooing toxic waste like TMA, which becomes trimethylamine oxidase and irritates the inner lining of your blood vessels and causes heart disease and cancer and all kinds. Or it could be pooing fertilizer like vitamin K and stuff you need. So you have to say, what determines whether your bacteria poo toxic waste in you or they poo fertilizer in you? And it's what you feed them. If you feed your organisms soluble fibers, your vegetables and sweet potatoes and all that stuff, you get fertilizer. If you feed them too much meat, fish, fowl, eggs, and dairy products, you get toxic waste. That's one of the reasons TMA levels are so much higher in meat eaters than in plant eaters. And so the type of bacteria you have are determined by what you eat, and also how much of the bacteria you have are determined by what you eat. And it turns out it's not so much how much that's important as what is important. The broader your diversity is thought to be associated with higher levels of immune protection, not just against cancer and heart disease, but even things like COVID-19. Gut diversity is associated with a higher level of resistance, lower likelihood of ending up in the hospital or dying or whatever, from infectious disease, from chronic disease. And what gives you the best diversity is a variety of plant-based foods. And so one of the reasons why these plant-based diets may enhance immunological function is because of the effect on the microbiome. And it's very, very important part of your immune system. In fact, if you take human beings and you divide them into 2 piles, human cells and non-human cells, it turns out the pile of cells that's non-human is actually bigger than the pile of cells that's human. You're more non-human cells than human cells, which is kind of bizarre when you think about it. And so it's important that you feed those cells that are protecting you by their diversity the right foods. And it turns out in fasting, there's a dramatic shift that happens with the microbiome in your body. And what happens is there's a big die-off. And then when you refeed properly after fasting, you get the big increasing diversity is the thought that happens. And a lot of these conditions associated with gut leakage and microbiome balance appear to heal during fasting and resolve and are better managed post-fasting. Now, we've actually done a study on this where we took stool samples before, after, and on long-term follow-up to look at this diversity. In fact, we did that with Luigi Fontana from Washington University. We don't have the results of that study yet, but we're waiting and we're very excited. We know clinically what happens, but we don't have the numbers to cite yet. Other things that go down in fasting, perhaps one of the most powerful reductions in fasting is inflammation. And the way we know that isn't just because the pain goes away, because the biomarkers associated with inflammation like IL-6 and TNF-alpha and all these other sophisticated biomarkers consistently, predictably go down during fasting. And actually, interestingly enough, if you follow it with a whole plant food SOS-free diet, they stay down, which is why we probably see such dramatic results in autoimmune diseases, rheumatoid arthritis, ulcerative colitis, ankylosing spondylitis, and diseases like asthma, eczema, psoriasis. In fact, we've got a paper coming out this year on plaque psoriasis, and it's really dramatic because you can see the pictures and the changes during fasting. It's really quite impressive. And then fasting reduces all of the abnormalities associated with metabolic syndrome. And honestly, metabolic syndrome is the epidemic that's killing most of the people prematurely in our society today. And in fact, you'll find probably the biggest risk factor for dying from, say, for example, COVID or other infections, influenza, et cetera, is having metabolic syndrome. Obesity, elevated lipids, elevated blood pressure, elevated blood glucose. We know that it takes 4 risk factors on average to have a high risk of mortality. And so metabolic syndrome gets to combine all of these wonderful consequences of dietary excess in one little package. And fasting is perhaps the most powerful way of reversing metabolic syndrome that I've witnessed, read about, seen, or anything else. Now, not everything goes down during fasting. Some things go up in fasting. So for example, things like adenopectin and ghrelin go up, and the higher they are, the better your insulin sensitivity is, which may be why diabetics, type 2 diabetics, respond so well to fasting. And then there's other biomarkers like AMPK, which is activated protein kinase. That downregulates PGC1 alpha, which is peroxisome proliferator activated receptor, and that increases mitochondrial biogenesis. And that's the bottom line, is that when you fast, there's more mitochondrial biogenesis. That's the little energy producing mechanisms in the cells themselves which may explain one of the mechanisms why these patients with chronic fatigue and seem to respond so well. It may be literally because they're making more mitochondria. We talked about the fuel that the brain burns in fasting is primarily beta-hydroxybutyric acid, BHB. It turns out the higher your BHB, the more you produce something called BDNF, which is brain-derived neurotrophic factor. And brain-derived neurotrophic factor is the neurochemical that prevents your brain nerve tissues from being damaged from oxidative damage from the crappy foods and the other inflammatory products. And that's associated with Alzheimer's disease. So and the other thing that increases BDNF is, guess what? Exercise. Longo talks about, they took 30 rats in 2 cages, genetically bred rats, so they're identical, fed the same, everything's the same, but they gave one set of rats a wheel, and the rats would exercise. And the exercise rats didn't get Alzheimer's disease. They wouldn't get the brain breakdown. He said, why? What's going on? So they check it all out, and they figured out it was because they had much higher BDNF levels, dramatically higher. Exercise increases BDNF. BDNF protects the brain from degeneration. Well, the other thing that profoundly affects BDNF, it turns out, is fasting. And so one thing you might want to start realizing is that it's not just that exercise and fasting increase BDNF, it's that a greasy, fatty, slimy, processed food diet suppresses it. And getting rid of dietary excess allows BDNF to go back to its normal levels, the levels it would be at if you weren't suppressing it. So bottom line is, rats that exercise have lower Alzheimer's rates. People that exercise are thought to have lower dementia vulnerability. People that fast have higher BDNF, which is thought to reduce the oxidative damage that occurs. Now, the other thing you could do is stop creating the oxidative damage by eating the foods that cause oxidative damage. Don't smoke, don't drink alcohol, including red wine, because the peroxidation of alcohol bathes the body in free radicals, which is why people get cirrhosis of the liver, because the liver has to detoxify the effects of alcohol. Don't eat fried foods, your potato chips, your French fries, oils heated at high temperatures, and don't eat refined carbohydrates, which also result in all kinds of changes. Instead, you eat fruits, vegetables, grains, legumes, nuts, and seeds. You avoid the processed foods, and then you don't have as much oxidative damage, and then you use fasting, whether it's intermittent fasting or occasional longer fasting, to reduce your lifelong risk of demential progression. We already talked about cellular stress resistance and cellular stress adaptation. That's the cell's ability in the fasting state to resist the damage of chemotherapy or other treatment, and how cancer cells are even more vulnerable. Now, remember, they're not just more vulnerable to chemotherapy. They're also more vulnerable to autophagy, which is enhanced during fasting. And that may explain why we see the results we're going to talk about, I imagine, later in terms of conditions like lymphoma. It was 2016 that the Nobel Prize was given to Yoshinori Ishimi for his work on autophagy. And now there's a lot more stuff coming out on this, which is really exciting because it happens to be one of the things that fasting kind of shines on, is in enhancing autophagy. And then we already talked about gut microbiome diversity, the fact that fasting stimulates B-cell immunity, it helps reboot the gut. And so there's a lot of stuff going on in fasting. Some stuff's going down, some stuff's going up. What we're able to see is the clinical outcome. We did a study with high blood pressure. We took 174 consecutive patients with hypertension. All 174 people lowered their pressure enough to eliminate the need for medication. We have the largest effects that have ever been shown in treating high blood pressure in humans, with an average effect size in stage 3 hypertension, where systolic blood pressure starts at 180 or above, of 60 points. That's average. So there's nothing that's been shown to be more effective than water-only fasting at resolving high blood pressure. And now we've got follow-up data showing not only do they get better, but they can stay better if they're willing to do dangerous and radical things like, exercise, go to bed on time, and eat a whole plant food diet. If they're willing to do those things, they can sustain that long term.
Well, yeah, then the lifestyle thing is such a big deal, right? This is not a crash diet. No. Sure, you can get some benefit from a water fast, and then you can go back to your old ways, and the benefit will eventually be diminished or eliminated, right? It's like you have to be willing to change your life for the long term and adopt healthy diet and lifestyle habits. Yes. Start exercising, start eating tons of fruits and vegetables, and then the periodic fasting, of course, I'm sure continues to be helpful.
Well, yeah, Walter Longo, actually, his group claims that even if you're eating a conventional diet, if you just periodically do intermittent fasting, there may be sustainable benefit. I don't know if that will hold up or not, but it's an interesting theory. We don't believe that just doing occasional water fast is enough. We believe it's diet, sleep, and exercise that drive health. And as I mentioned, sometimes if you just do that diligently over enough time, you get well, whether you fast or you don't fast. But we believe everybody should fast every day for 12 to 16 hours and limit your feeding window to 8 to 12 hours. The reason there's a variance is if you're trying to gain weight, 8 hours of feeding may not be enough to get enough calories of this low density food. If you're trying to lose weight, then 8 hours is plenty. And so you limit your feeding. But the point is that gives you a 12 to 16 hour fast every day. And even that brief amount of fasting may help undo some of the consequences of excess. And then if you occasionally do a longer medically supervised fast, there may be additional benefit. And that's what our research is looking at now. And I'm really excited because we just got the first data back. In the 39 years I've been doing this, I've been claiming that sick people get well, and that's all very nice. But I believe that healthy people that fast periodically may get additional benefit. And now I've got some data to actually support that. We looked at these biomarkers associated with inflammation and other things, and they go down and improve in people that are sick. But it turns out they also improve, in fact, even more so in healthy people. Some of the effects on healthy people are even more profound than on sick people, which isn't like shocking because healthy people have a lot of vigor, and it's not surprising that they could do a lot in a short amount of time, and they do. And so we'll be publishing some of that data this year, looking at what are the biomarker changes in healthy people, not just in sick people. One of the challenges today, though, is it's hard to find actually healthy people, because even people that are asymptomatic, when you actually delve into looking at some of their detailed biomarkers, aren't so healthy as you might think.
Yeah, everybody thinks they're healthy, and 40% of us are obese, and over 70% are overweight.
Yeah. Well, not only that, but a lot of people that are not overweight and don't have symptoms, when you actually get into their evaluations, they're not quite as healthy as they think. And one of the best ways to tell is to put them on a fast, because fasting is both therapeutic as well as diagnostic. And a lot of the symptoms that come up in fasting give us a clue about where the imbalances in the body are, whether it's digestive system issues, whether there's problems with liver or kidney function. A lot of stuff will show up during fasting that gives us a clue that there's actually some dysfunction. The body's ability to adapt to the fasting process itself is a diagnostic tool.
Oh, so
how rapidly those blood sugars drop down to normal, or whether there's insulin resistance. And we're getting more sophisticated biomarkers. We can do blood tests to determine some of this, but just the clinical observation of the fasting patient. And what's interesting is the people that I see that are healthiest have relatively few problems fasting. They go on the fast, they might be a little bored or whatever, but they don't have the interesting, exciting healing crisis. And the people that I'm seeing that fast the best are the people that work at True North Health Center that eat this way all year long. And those fasts tend to be quite boring. Whereas people that are on a lot of these supposedly health-promoting diets, where they're eating a lot of processed foods, lots of supplements, lots of stuff, they don't do quite as well until they, get a lot of that stuff out of their system. And supplementation itself is a highly concentrated, highly processed food products. Doesn't always lend itself to the high degree of health that people are thinking it is when they spend all that money buying all the pills and potions. So I'd say that we have to exercise some caution, even in some of our attempts to do life extension techniques through hyper vitamin nutrient concentrates. Sometimes even those too much can be a problem.
That makes sense. Absolutely. I mean, you look at the healthiest people around the world, and they're not taking, handfuls of supplements, right? The longest living people, they're not doing that. They never have in all of history. So I totally get that. And on the same token, I'm still attracted to supplementation, right?
I understand. All I'm saying is not that there's not a role potentially for supplementation. It's just that you need to not just assume because it's a supplement that necessarily means you can take any quantity of it without overloading the system. For example, too much food, you get obese. Even healthy foods, if you eat too much, you can make yourself too much water. They call it drowning, don't they? I mean, but I mean, if you drink too much water, you can flush out your electrolytes and die. There's been evidence of, water intoxication. So too much of anything can be a problem. And many of these supplements are very, very concentrated. And people are not sick, in my opinion, generally from deficiencies. They're sick from excess fats, excess protein, excess concentrated supplements, that if you get people on a whole plant food SOS-free diet, they have very little propensity for deficiency. The only nutrient that we consistently find to be an issue on vegan SOS-free diets is vitamin B12. And that's because B12 only comes from bacteria. In a natural setting, you'd never have to worry about it because you get plenty of bacterial contamination. And in a hyperhygienic world where we wash and peel everything, we're all careful because we don't want worms and parasites and all that. You can, over enough years, deplete your B12 stores. Meat eaters get so much fecal contamination in their meat, so much B12 inherent in the animal product, it's less likely to be a problem. But plant eaters, we do recommend supplementation of 1,000 micrograms of methylcobalamin a day for people exclusively on plant food diets to avoid the lack of bacterial contamination that's inherent in people that are eating a more traditional diet.
That makes sense. I'd love to know your opinion on, okay, so we know that when animals get sick, they stop eating, right? They fast. And when humans get sick, a lot of times we also lose our appetite,
Yes.
at least for a day or so, especially if you're running a fever, you're in bed and you're not hungry. Now, do you have any opinion on if someone is they have an influenza-like illness, right? Whether it's the flu or COVID or something else.
Yes.
They're running a fever. They're in bed. Should they? How long should they try to not eat? Is there some period of time when you are actually fighting an active infection that you need calories, you need glucose, right? You need energy from food?
Well, actually, the most efficient way of fighting most acute responses is during the fasting state. The body does the most effective job. And we certainly treat a lot of patients with acute infections with fasting. But the thing I would say is that if you're going to fast over 16 hours a day, we recommend that be done in a controlled setting because there are issues of dehydration. There are issues of hypo or hyperglycemia. There's concerns and problems, particularly for medicated patients. So you need to work with a doctor that's not an idiot, that's used to people getting well, whether it's in person or remotely. And the reason we do that is because people can really make a mess of it. And it's not the fasting that's the problem, it's the recovery feeding. And too rapid a refeeding, particularly after long-term fasting, can be very serious, including even fatal. With refeeding syndrome and other problems that can develop. So it's well known medically, but not, most people don't have experience with people fasting. So they make mistakes. They hyperhydrate people. They put them onto they'll put IV fluids into them, hyperhydrate them. They get into congestive heart failure. They have problems. So we want to avoid refeeding syndrome. We want to avoid problems. And so that's why we recommend if you're going to extend the water only fasting, do that in a controlled setting. Now, there's things you can do safely at home. Everybody should fast every day for 16 hours, and that includes if you're acutely ill. And then what we'd recommend is that they go on a modified version, depending on their specific medical history. But we'll use fruit or vegetable-based juices, about 650, 750 calories a day. What that does is it keeps them hydrated. It gives them enough glucose so that they can carry out function, less vulnerable to orthostatic hypotension, but it's a light enough load on the body that it doesn't interfere with its ability to generate a fever and resolve the infection. What you don't want to do is suppress the fever. When you take fever-suppressing medications, every degree your body temperature goes up, there's a tenfold increase in your body's ability to fight infection and deal with these issues. For example, bacteria don't sequester iron at elevated temperatures. So fever is part of the benefit of fever is it gets bacteria inability to synthesize some of its necessary nutrients. When you suppress the fever, you're actually helping the infection stay alive in the body. So fever can serve, but fever can also be the elevated temperature, elevated metabolic rate, increased risk of dehydration. And that's really what the risk is dehydration. That's why you want to be in a situation where that can be monitored effectively and dealt with if necessary, including in the most extreme cases with IV fluids. We don't have to do that. One fast per 1,000 do we have to resort to IV fluids because we're used to maintaining oral hydration with people. And usually with simplest things like watermelon celery juice and other things that we use, broth and things, you can keep people hydrated. If you keep them hydrated, then the body has enough time to fight off the infection. The immune system begins to run. People that are dying in the hospitals a lot of times are dying as a consequence of dehydration. That's why probably one of the single biggest miracles of modern medicine was actually learning how to use IV fluids. That has probably saved more lives than certainly just about anything. And particularly with viral infections where antibiotics aren't even on the table. You take all the antibiotics you want, it's not going to solve a viral infection. So But maintaining hydration, and particularly in younger people where they're more vulnerable to that, that becomes a really important issue.
Yeah, I'm thinking about myself specifically because I ran a fever, I don't know, 3 or 4 weeks ago. And I
Yes.
had a fever of 102 for a day and a half.
Hmm.
And maybe it was COVID, maybe it was the flu. I don't care. Like whatever it was, like I've
Sure.
had fevers before. I've been sick before.
You'll have them again.
Yeah, it won't be the last time. But yeah, I got in my bed. My daughter had it, and then my wife got it 4 days later, and then I got it.
Hmm.
And yeah, I got in the bed, and I had a fever, and it certainly wasn't pleasant. But I'm thinking about in the future, and I try not to eat because I do know. And the first day, I'm sure I didn't eat at all. But I'm just thinking about the best strategy for me in the future if I develop and some other kind of fever producing
Sure.
viral infection or whatever. Yeah, it sounds like fresh juices are helpful or
Well, if you take juices, especially vegetable-based juices and broth, the chance of dehydration, which is the real risk factor, frankly,
yeah,
is less. So you monitor that, you rest. This isn't when you go to work.
right.
This isn't when you're driving around. Okay, so you're getting somebody to take care of you. And you rest and you hydrate, and there's a very much lower risk of running into problems. And if you don't respond appropriately, then you can always, seek help. But what I wouldn't recommend is go on a prolonged water-only fast, without appropriate monitoring. Because I have a bias though. I get calls. I talk to maybe 200 people a week, because we offer a free service where people can call, fill out the registration forms on our website, and we offer a free phone conversation with me to help people decide, is fasting something they should be thinking about, or they want me to match them up with a doctor that can help them with their issues. And so the bias is that I get people calling me, they're 6 days or 16 days into a fast. They've really not prepped well. They don't have any baseline data. They have nothing to monitor on. And they're going and getting really bad advice about how to deal with it. And so I have like a bias because people don't follow good advice, or they didn't know, and they aren't resting, and they're not taking care of business. And that can become a really serious problem. We don't want that because it makes fasting look really bad and dangerous when it's actually very safe. And we can prove that because we have a fasting safety study. We actually did a study, took all the patients over 5 years that went through True North Health Center and looked at all their adverse events, analyzed it, and have published a study in the peer-reviewed literature. And the conclusion is that fasting is a safe and effective process if you follow those protocols. But you got to follow the protocols. It's not safe and effective if you're crazy with it.
How much water do you encourage patients
Yes.
to drink per day when they're on a fast?
It depends on how much water they need, and the way we tell is we monitor their specific gravity in their urine and make sure they're staying hydrated. But the general rules of thumb, at least 40 ounces a day of water, and it could be as much as 80 ounces a day. The problem is too much water can be a problem too, because you can flush out your sodium and end up with cardiac instability and other problems. So we're monitoring it every day to make sure people are in a standard, within the range. And that's why we're also using blood and urine testing to look at electrolytes, to look at liver and kidney function tests, so that we can make sure it's done safely. And we know that the protocol works because we've done it 21,000 times over 39 years. And so far, everybody that's walked into fast has walked out. In fact, we have a really strict rule, is that if you walk in, you have to walk out so you don't mess up our safety data. So
Sure.
we know the protocol we use. It might be overly strict. Some people maybe they didn't have to have all that careful. But if we follow that protocol, we know that we have a very high likelihood of getting a safe outcome. And we're able to catch the things that might become a problem very early where they're easy to deal with. For example, in this study, we had no category 5, which is death events. We had only one category 4 event, which is, serious medical consequence. And that was a hyponatremic situation. They had no problem because we caught it on the blood test, broke the fast, they did fine. But if you had not caught it, it could have become a very serious problem. Of the category 3 events, most of them are hypertensive crises. And you say, well, why would you have a hypertensive crisis? That is a blood pressure over 160 on a fast, if fasting is supposedly so good at treating high blood pressure. Here's how it works. If you come in and your blood pressure is 220 over 120, you're capped out on 5 medications, and the next year your blood pressure is 200, and then it's 180, and then it's 170, every one of those days is an adverse event, because it's any day your blood pressure, regardless of whether it's improving or going. And so most of our category 3 events are people that start off with really high blood pressure and it's working its way down. In fact, virtually all of the people with blood pressure will end up with normal blood pressure. if they're willing to fast, and they'll sustain it if they're able to eat well. Most of the adverse events are category 1 and 2 events. They have their mouth coats up and tastes like something crawled in there and died. They get skin elimination, mucus discharge, low back pain, headache, irritability, sleep disruption. These are common universal symptoms of fasting. It sounds wonderful, doesn't it?
Yeah. And
But,
like swelling, there was
oh my gosh.
I interviewed Dr. Nathan Gershfeld, who is a student and protege of yours.
He is.
Recently, and someone commented when I shared that interview and said, I did a fast, and I think they were like, I tried to do a water fast, and on day 2, I felt like my thyroid was swelling up, and I got scared and I quit.
Yeah, and if you talk to Dr. Gershfeld, he was originally a patient of mine. He'll tell you about his personal experience with what happens.
Yeah.
Well, I guess when you get inflammation, things swell, and that's part of the resolution. In fact, I
It's
just
part
want
of
to
the
mention,
process.
one of the doctors we refer patients to, he's in Orange County, and he's doing a fabulous job. He has a small facility, does a fabulous job with fasting supervision, and he's one of the people that we're actively referring patients to that need to fast before they can even get into True North, because we've got a little bit of a wait list. We also have another woman in Ohio that we refer to that also trained with us for several years.
Who is that?
So that's Dr. Ewan, Gracie Ewan in Ohio. And
anybody on the East Coast?
There are. One of my favorite people is Dr. Stephan Esser. And Dr. Esser is a Harvard graduate working for the Mayo Clinic right now doing stem cell work. And he's in the process of opening up a True Northeast in Florida, in Jacksonville. So it's not ready yet, but he will be opening. And he's a fabulously bright, wonderful guy who was raised by his grandfather, William Esser, who was one of the original natural hygienists, and he was raised at a fasting facility. And he's already trained with us, and so he's going to be a really great person on the East Coast. There's also Frank Sabatino on the East Coast, who works. He's on one of our phone coaches, so people can work with him remotely through our telemedicine practice, which is really a cool thing now, that people can go online and you can have a Zoom session with the doctor and they can guide you. And that's particularly going to be true if somebody is going to do a fast on their own. I would definitely encourage you work with one of these doctors who can work with you and your local physician to get the testing necessary to provide support and feedback and give you encouragement and coaching and guidance, so you don't make a mistake and end up with some problem that's totally unnecessary.
That's great. Okay, so we've only got a few minutes left, and I want to make sure we talk about the lymphoma study, the case study that you did, because I know this will be really encouraging for cancer patients out there. Yeah,
it turns out we've now worked with a whole lot of lymphoma patients. In fact, I have several of them here right now. And it is really exciting to us. We're hoping to publish enough of these case reports to justify a clinical trial on the treatment of lymphoma. But the first one that we actually published was water-only fasting and an exclusively plant foods diet in the management of stage 3A low-grade follicular lymphoma. It was published in the British Medical Journal in 2015. And in this study, we took a 42-year-old female who was diagnosed with follicular lymphoma stage 3. She'd had her excisional biopsy. They had tracked her for 2 years with progression. She had a CT-guided core biopsy and confirmed the diagnosis. No question about her diagnosis.
And she did chemotherapy, right?
No, she refused chemotherapy.
Got it.
So she was recommended to do chemotherapy, but she had her tumor was 34 by 20 millimeters. She had both right and left sided, upper and lower. And so her oncologist actually was one of those people that when she asked him if fasting was an option, he told her that was criminal quackery. So she did decide anyway to come in, and she fasted here for 3 weeks, during which time her palpable tumors disappeared. And so she fasted, refed for 10 days, went back, ended up, to make a long story short, ended up with follow-up CT scans, and over time resolved her tumors. And so after a year, we published her case report in the British Medical Journal. And they said, but look, you need to follow this woman long-term because, 10% of lymphoma patients go through periods of remission. They tend to recur. So let's see if you can sustain this outcome. And so we continued to track her. She continued to follow a whole plant food SOS-free diet. At 3 years, we got a whole body CT. She's completely cancer-free. And she has continued to follow a whole plant food SOS-free diet. We did another fast after we got the diagnostics preventively. And then a few weeks ago, we got her 6-year follow-up. and she continues to be cancer-free. And so now we'll be bringing her back in for her another follow-up preventative fast. And so now it's been 8 years since diagnosis, and her doom and gloom advice she was given originally has been really reversed, and she's done well. And so we published that follow-up study also in the British Medical Journal. And so now we have a number of patients. Since those papers came out, we've been treating a lot of lymphoma patients, and the results are consistent. You're seeing that the masses are going down. We're trying to get follow-up CTs and follow-up outcome data. One of the challenges, a lot of these people, like I just had a gentleman that came in and fasted for 40 days. And during that time, there was dramatic reduction in his masses. And we sent him back for his follow-up CT, but his oncologist refused to do the CT because he said he was clearly better. There was no justification for doing expensive studies in somebody that was, and so he did agree he would do it at 6 months. So now we have to wait another 3 months to get the evidence to prove, because they won't publish the studies based on, people feeling things. They got to have objective markers. But, and he's right. I mean, the person's clearly getting better. And so, doing studies is, of questionable benefit to the patient. It's just benefit to us. So anyway.
Uncooperative oncologists.
Now, the other problem is we have to get
pain.
compliance. I've had some patients that did great, but then when they go back to drinking or doing the other stuff comes back. Now, in the case of Yvonne, we got excellent compliance, because I explained to her that if she didn't comply, it could be fatal, because I would track her down and kill her. And she believed me, because she's stuck. She's been really good. So she's been a highly compliant patient. Now, as far as some of these other patients, the ones that are complying appear to be maintaining good results. And so as we publish these outcomes, at some point, there'll be enough data to justify clinical trial. What that means is there'll be 60 people enrolled in the trial. 30 of them will get the benefits of fasting and diet. The other 30 will get conventional care, and we'll compare and contrast over the long term. Who does better. And I can tell you what my expectation is, we're going to kick some ass there, because the results clinically appear to be very strong.
I'm excited. I can't wait to see that. And the beautiful thing about a fasting study is there's almost no confounding factors, because they're doing nothing, right? Yeah. It's like, you can't say, oh, it was the supplement, or, oh, it was whatever. It's like, no, literally they did nothing, right? Yep. It was the water or the lack of everything else. I
did a continuing ed seminar at one of the medical schools one time, and that's how they introduced me. He says, this is a doctor who's an expert at doing nothing.
Yeah. It is incredible what the body can do, that the body is capable of healing if we get out of the way. And if what I like to repeat to my audience all the time is, the body creates cancer, and the body can heal it if given the proper nutrients and care. And sometimes the nutrients part is no nutrients, right? It's the fasting part.
For people that want to learn more about fasting, they can also read our book. We have a book called The Pleasure Trap, and it talks about the diet, but also talks about fasting. And it's a really useful thing. And for those of your viewers that are clinicians, we do have internship and residency training for doctors that want to do something worthwhile with their life. And they can come. There's no cost. We provide through our foundation. They're given room, board, training. It's all taken care of by the foundation. And they can learn how to actually get people well. The most common comment of our residents, including we have second and third year residents that come from Texas A&M and other schools where we have a relationship. And they'll say, oh, wow, it's the first time I ever saw somebody with this condition get well, whether it's high blood pressure. Because under conventional care, they're told, take these drugs and we promise you, you'll never get well. We guarantee you'll be sick the rest of your life, and you'll die either from your condition or the treatment of your condition, because we know that nobody with blood pressure medications ever normalizes their blood pressure. No diabetics are told, oh, well, you're going to take the drugs for 2 weeks and then you'll be better. No, you'll be on the drugs how long? For the rest of your life. They know it in advance, because they're not dealing with the actual cause of the problem. And when you address diet and lifestyle, you're trying to deal with the reason people, we spend our money in this country treating the leading cause of death, heart disease, cancer, and stroke. That's where billions of dollars are spent, not the actual cause of death. Smoking, drinking, eating animal foods and highly processed refined carbohydrates. If we put our money into treating the actual cause of the death, we would have a lot better outcome in life extension and healthy life extension. How long people live and how well people live. People are spending 9.6 years debilitated because they're worrying about treating the disease after it's developed rather than preventative. And that's where diet and fasting have a lot to offer, is helping you live until you die, not spend the last 10 years of your life unable to talk or move, lying in some nursing home bed waiting for people to change your diaper, but rather live functionally till one night you go to sleep and you don't wake up because you've reached your genetic potential.
That's the
Good
goal,
life
baby,
and a
right
good
there.
death. You got it.
I say it all the time. I want to live to a ripe old age and die in my sleep.
That's
That's the
right.
goal. That
You know,
is my goal. And I appreciate what you said, but I think one day they're going to come up with a drug that's gonna solve all of humanity's problems.
okay, well, I hope they do. That would be great. In the meantime, we're going to resort to diet, sleep, exercise, and fasting.
It's an awesome strategy. Dr. Goldhamer, thank you so much for your time. I just am so appreciative of you and so thankful for you as a cancer survivor, as a patient, as somebody who is a health and wellness advocate, because you were doing the hard work when it was definitely not popular. And you went against the grain as a young man, in 1984, opening a fasting clinic. I mean, that to me is just so incredible and so awesome. And I know you stood on the shoulders of men like Herbert Shelton, and there's another generation that has been inspired by and informed by and educated by you, and you've helped thousands of patients. I mean, just what an incredible legacy. And you're only 63, man. You look like you're my age, 45.
Yeah, well, like at the basketball court, they call me the old man. So, of course, they say, "See that old guy? Yeah, just don't let him shoot."
As long as you don't play like an old man, that's the most important thing. All right. Well, thanks again. Hey, everybody. Thanks for watching. You can find and connect with Dr. Goldhamer at truenorthhealth.com. Tons of resources there. Of course, you can do a consultation, figure out if water fasting with their clinic or doing it remotely is right for you. And I hope you will look into this, because almost everyone can benefit from this. I mean, I have water fasted personally many times, and I'm a fan. So thanks for watching. Please share this with people you care about. We'll see you on the next one.